had a patient coming in who had a ACL, that is the anterior cruciate ligament tear. We fixed it and he cannot believe they can actually function normally.
This is the Bloom Podcast. Your health is our priority.
My name's Dr. Virinderpal Chauhan. I'm a consultant orthopedic and trauma surgeon with a keen interest in arthroscopy and sports medicine.
Welcome, Doc.
Thank you.
There is this myth that arthroscopy can only be done to the athletes. What exactly is arthroscopy?
Arthroscopy comes from the word arthro, which means joint, and scopy means to look into a joint or to scope into a joint.
So basically, it's like instruments that are used to see inside the joint. Eh?
Yes.
This arthroscopy, can it be used to everyone?
Arthroscopy is for all.
Okay.
We can't say that you're too young for arthroscopy or you're too old for arthroscopy. Basically, it depends on what injury you have in your knee or your shoulder or any other joint, and what is required. What happens is that we have people who are eligible for arthroscopy. They're those, their joint keeps on paining. They have taken all the medicines. They've gone to physiotherapy. They've tried everything, but they're still having pain. Now, that is someone who needs further investigation for arthroscopy. We may also have people who are having symptoms, like you might find you're walking and down in town and all of a sudden you find that your knee has locked or your shoulder cannot move or something is wrong. That is someone who probably needs arthroscopy. And of course, when you have some challenge, maybe a sporty person, you've gone in, you've done a few things, and then you're diagnosed with an injury, that is someone who's eligible for arthroscopy. Yeah.
Then in some way we can say that arthroscopy, it's way better compared to the traditional ways of surgery.
Yes, I think definitely when you have a minimally invasive surgery and you have better equipment and better ways of diagnosing and treating a problem, the world is advancing. Many people are moving into this. I think most of the people also want cosmetic kind of surgeries, and arthroscopy definitely comes into such kind of things.
Then it's a good thing.
Yeah.
It seems like you have a lot of knowledge in this.
Yes. The doctors, we are always learning until the day we go down 6 feet under. We'll still be learning, and we'll still be learning. Arthroscopy has a lot of benefits. First of all, it's minimally invasive. When you have incisions in your skin, which are the size of a pen, definitely your healing becomes better.
Sure.
So that is the first thing. And when you have very small incisions in your knee or your shoulder, your recovery is also faster. Yeah, you don't, the stitches that are there, maybe you just have one stitch, and that heals very fast. And if you're going to heal faster, your rehabilitation and getting back to what you are doing is also faster.
Yeah, sure.
That's also the second thing that's there. So basically we are looking at the medial compartment now. I think you can see that. There are some signs of gout here, or something closer to that. You see that? Yeah, there's some, you see up there, there's some signs of gout there. These days also there's some arthroscopic procedures that can be done as outpatient. So you come in the morning, we do the procedure for you, and you go back home in the evening. So that is also made possible by doing this minimally invasive procedures. All this is synovium. So this already tells you that the knee was a bit angry, as you can see. So we are just clearing off so that you can have a good look inside there. When you don't have very big incisions, you'll also get less pain after surgery. So when you have less pain, it means you move faster.
And you heal faster.
Yes, please. Yes, please. Yeah.
So look, based on that, seeing is believing, eh?
Yes.
And it's true that a lot of people have heard a lot of things concerning arthroscopy because like the one we started with, I've come to realize it's a myth, as you have explained.
Yes. Well, I think the first myth that is all over, even how arthroscopy came about, people thought it's just for athletes. That's not true. Our Kenyan population, there are many people going to gyms now. There are many people on the road running about. There are many people who are very health conscious now. So believe it or not, most of our patients, non-athletes. So yeah, we are done, and we've done a repair. We've done an anterior horn lateral meniscal tear that has been repaired arthroscopically. 2 mosquito bites, which I've shown you before, and now we need to protect it with a brace. And this is what you're gonna put. And then the guy is on, most probably goes home tomorrow. That's the beauty. Health is wealth. So if you're healthy, you will be wealthy. Yeah. And if you don't take care of your health, definitely things, you'll keep on postponing so many things, especially when it comes with these injuries. Remember, you can get an injury, you might have had an accident many years ago, and then you just have that nagging pain in your shoulder or your knee. It's time you have to get it checked. And usually a procedure like arthroscopy, a minimally invasive procedure, can help you fix something. And you won't believe it how much you'll be able to do, or how much you'll be able to regain by just doing a small procedure, and how you'll be able to go ahead and do your normal tasks. And you'll ask yourself, I have patients who tell me that I wish I'd done this surgery longer. So yes, if you're suspicious of any injury, if you have a niggle in your knee or a shoulder, if you think there's something you can't do, remember, orthopedics is all about restoring mobility and getting you back to what you used to do and maybe do it better.
Thank you so much, Doc.
Thank you so much.
Thank you so much for watching this video. And I only need one thing from you. Make sure you check your knee. Make sure you check your joints, whether you have any problem. And you can spread this video to somebody else so that they can also gain, or they can catch up something from this video. So thank you, Doc, for coming in.
Thank you so much.
Next time when we need you, I hope you shall be back.
We hope you're not going to repair your knee.